I'm Laura Lee. I live in Durham, North Carolina, and I'm a caregiver, one of several caregivers to my dad, David Lee, who was diagnosed with cholangiocarcinoma in 2019. My hobbies are yoga, cooking, reading, playing with the world's best nephews and niece. I'm a journalist, and I work on investigative projects mostly. My dad was diagnosed in February of 2019, and at the time he was diagnosed stage 4. He had been otherwise very healthy. We were really shocked at this diagnosis. It was sort of happenstance that his primary care physician asked him about. He had complained that he had some sort of pulling sensation in his stomach, and really just as an offhand, almost after the appointment at a routine visit, his doctor asked about it again, and he said that it was still there. And so that's when they decided to sort of explore further and see if they could figure out the cause. So we were tremendously shocked to find out that he had a softball-sized tumor in his liver. We were fortunate in that he has a great provider near Charlotte where they live, Dr. Browse, who's his primary oncologist. But then in learning more about the disease and understanding how rare it is, we decided also to go to MD Anderson to see Dr. Javli there. So those providers decided to treat him initially with a really standard chemotherapy, Gemcis, which I think is common for a lot of people who are diagnosed with cholangiocarcinoma. He had a large tumor and he had several satellite tumors. So he was treated with the chemo for several months, and it worked to some degree, but there were some satellites that they were still concerned about. So in July of that year, he had a Y90 radiation procedure. So at the time of his biopsy, we were able to send a sample off for genomic testing, which we really didn't know a lot about at the time. His doctor in the Charlotte area had recommended it, and Dr. Javli, of course, agreed with that. And so when he got his report back from Foundation One, he was really fortunate because he had a mutation, IDH1 mutation, that there was a drug in development, been developed for a different kind of cancer. But he was fortunate enough to get started on that, and that's Tibsovo. And so he's been on that since June or July of 2019. And really, it's been a wonder drug for him. We really feel like the genomic testing opened some doors that he would not have had otherwise. I think if there was something that I would tell a newly diagnosed patient or their family, it's to not give up hope. A lot of the statistics are dated, and so those statistics are not necessarily going to be your experience. Stay hopeful and stay the course. Learn as much as you possibly can, and then really staying connected as much as you can to other people who have gone through this, because the science is changing all the time. Being a caregiver can be really difficult, and I think especially at the beginning, it's all consuming. And so I think a lot of times when you're a caregiver, you're so focused on the patient's health and the patient's well-being. And I would just say to remember to take care of yourself. And I know that's easier said than done, but I realized this as I was pushing my dad to exercise, particularly when he was in chemo, that I also could push myself to exercise. So just doing those day-to-day things to take care of yourself, to keeping your life outside of being a caregiver alive. I think that's really helped me stay grounded and helped me stay positive. I think I first learned of the foundation probably from Google, reading the discussion boards and understanding what other people's experiences had been. Has been really super helpful. I've connected with some of those people also on the Facebook groups. I think the connections that you can make through the foundation are really important. I also think some of the materials there, especially I refer people a lot to the Mutation Matters, just to explain how that process works, understanding how genomic testing might be useful and what doors that could potentially open. At the outset, things can seem so bleak and so difficult that it's hard to have hope. But I think you really just have to hold on to that and look towards the future, and at the same time sort of stay in the moment, in the present, you know, maximizing the time that you do have with the people that you love, including people who have cholangiocarcinoma. I'm really hopeful about the scientific developments. I follow a lot of the drug development and treatment development news, and the strides that science is making on treatment of cancer and treatment of cholangiocarcinoma in particular are pretty incredible.